that spirit lives in all of us. We have one more speaker that we're going to get Edith back up here. The speaker we have right now is Kay Beamer. She's actually a nurse, and you should never believe for a moment that the healthcare system or those that are working in healthcare are clearly against what we're proposing. That is far from the truth. All right, Kay, come on up here.
I come to you as two people. One, as a nurse with Fort Wayne Community Schools. My passion is public health care and education. And I also come to you as a private individual, a citizen who's voted in every election that I could get to for over 30 years, someone who passionately loves my country, someone who has a strong faith. We share much. I mean, we are all humans. I believe that health care is necessary for life. I've seen many people in the hospitals fighting with insurance companies and denied things that they need. I saw a young mother who was fortunate enough to have an organ transplant, which she needed for life. She was in the hospital. Her insurance had some kind of a loophole where she had capped out on a medication benefit. And she was being denied the medicine she needed so that her body would not reject the organ. Her insurance company was signing her death warrant. She had young preschool children and a husband. She worked in our community. And the hospital was doing everything possible for this woman to get that medication reinstated. For those who are blessed to have jobs, full-time jobs and insurance, even when you've got insurance, the insurance company steps between you and your doctor many, many, many times. Many times you're not aware of. But if you speak with your doctors and the nurses and the people that are doing the paperwork in the doctor's offices, they will tell you how much they are not allowed to do for you, how much the insurance companies are telling them to do, and how much it costs them to do what the insurance companies require. Insurance, as we know it now, is not the best system. It's better than nothing, yes, and for those who have it, you know, we are blessed to have that. But there are so many parts of it that are broken. I believe that health care is a human right, as is education. Freedom to worship. Our school systems are public, and they are not for profit. Should health care be any different? In the school systems, I see families struggling more and more as our economy fails. It has gone down, and they're without jobs and they're without health care. And not only do I get children that I'm advocating for that need medicines. I had a student last year who was hospitalized twice in an intensive care unit, just needed a medicine. But I also see parents come and they don't have health care. And sometimes they'll come and ask. I'm only a nurse, I'm not a doctor. I try to help in the ways that I can, and we try to steer people to places so that they can get health care that's provided by Matthew 25 and the neighborhood health clinic and such. And we are so fortunate in Fort Wayne to have many community organizations that stand in the gap for the many, many, many people here that don't have health care. But there are many that don't go to those places. We have many young people, high schoolers. Once you're out of high school, unless you're in college, you lose your health insurance if you go under your parents' plan. If you're a college student and you age out, you hit a certain age, you lose your health care. If you've not been fortunate enough to be picked up in a full-time job that offers health insurance. Even if your company offers health insurance, you may not be able to afford the premiums. If you can afford the premiums, can you afford the co-pays and the high deductibles and so forth? On and on and on it goes. When I was in nursing school, I had a wonderful doctor as a professor. And I would stay after class and ask him questions about our healthcare system and how we could make it better. He had left the healthcare profession, and I could tell that it broke his heart. And I know he was an awesome doctor, and I was so lucky to have him as a professor. And I could tell that his passion was helping people. He said he had been educated for 17 years of his life to become a doctor because he wanted to help people. But with the insurance the way it is, and with malpractice the way it was, and all the astronomical insurance you have to pay to practice defensive medicine and so forth, he couldn't do it anymore. So he was teaching others to step into that healthcare profession. And he told me, he said, you know, our system is broken the way it is. It is so broken. And we're going to lose more and more doctors. In many states in the United States, there are holes in the state where there are types of doctors missing. Obstetrician is one. Someone who delivers babies, because there's a high litigation rate. And there are some states where obstetricians won't practice. Indiana is not one of those states. We have a law that is in place to help the doctors with that. But anyway, so I asked him, you know, what would it take to fix our system? And his response to me, and it's burned into my head because it scared the bejeebers out of me, he said, you know, I think it would take the collapse of our society, God forbid. Something like a nuclear attack, before our healthcare system could be changed, because it's based on the almighty dollar. Is the dollar almighty? In my heart, it's not. I watched a neighbor, next door neighbor, whose husband in his 30s was diagnosed with cancer. They owned a business. They had health insurance. He died within 2 years. They lost their business. She lost the house. Medical bankruptcy. On and on and on it goes. I've been through the things with pre-existing conditions where you can't seek treatment for a year in order to be covered under an insurance that you're paying maybe a quarter of your income for. We've been without insurance for periods of time when corporate buyouts come in. My husband's never left his job, but from time to time another company has bought that company and you go without. I've been a single parent with children and worried about how long can I afford to pay these healthcare premiums in case something bad happens to my children. I've worked in the retail sector and interviewed. When I was an office manager, I interviewed people, and I was amazed at the number of people that were just looking for a job where they could possibly get into some kind of healthcare coverage. That was a big, big deal. On the other side of that, I sat in on meetings with our owner and later with employee ownership, and we looked at the costs of healthcare insurance on the company, small company, less than 50 employees. And sometimes just those premiums, as a business owner, the tail almost wags the dog, because you want to offer those things to your employees, but the costs are exorbitant. And if you've got health insurance care and coverage, and you know how much your premiums are, your company is paying way, way, way more than that. So the part you're looking at and thinking, man, this is way too much for health insurance, it's actually costing much more than that. There are so many problems. And anything that we can do to change, we've got to fight for it. I ask you as individuals, and I challenge those also that are circling us, to use your minds, the minds that God's given you, to listen, to read for yourselves, not to believe everything that you read in print or see on TV or see on a blog site or on an internet place. There are many, many false truths. And we need to sit down